Cause, Care and Cure, organized by IIT MBCET and Automate MBCET in association with IMA and WIMA NAMM. Cancer is a significant health concern that can affect people of all ages, including young adults. As college students, it is essential to understand the causes, preventive measures, early detection methods, and common misconceptions associated with cancer. We encourage you to engage actively, ask questions, and take this opportunity to enhance your awareness and knowledge, which can make a meaningful difference in your lives and the lives of others. Now, I invite Gayathri, the Secretary of IIT MBCET, for the welcome address.
A very good evening, everyone. On behalf of IIT MBCET and Automate MBCET, in association with WIMA, IMA, NAMM, I warmly welcome you all to today's session on cancer cause, care, and cure. We are honored to welcome Dr. Indirama, President of IMA NAMM, Senior Consultant Surgeon at NIMS and Anandapuri Hospitals, and Dr. Susie Alex, Chairperson of WIMA, IMA NAMM, Specialist of the Obstetrician and Gynecologist at KIMS Health. It's a great privilege to have with us Dr. Gayathri Gopan, Consultant Medical Oncologist at GG Hospital and Sri Ramakrishna Hospital. With her extensive clinical expertise and strong commitment to cancer care and patient awareness, we are confident that today's session will be highly informative and impactful for everyone present. We hope this session inspires greater awareness, early detection, and healthier lifestyle choices. Thank you all for joining us today. I now request Dr. Indirama to inaugurate the talk session.
Okay, thank you. Good evening, everyone. Respected NAMM, Bima, Chairperson, and today's Chair, thank you. CP Alex. Respected Dr. Gayathri Gopan, today's faculty. Dear IMA colleagues, dear students and faculty of Mar Basilius, dear Dr. Saumya, our own coordinator, and all the others. It is a privilege to be with you this evening. World Cancer Day. The very word cancer evokes mixed feelings of fear, sadness, and helplessness among ordinary mortals like us. To many, the diagnosis of cancer is like a death sentence. In fact, it is not so. There are any curable by ordinary standards. Each individual is unique. So are cancer patients. So the expression of the disease, including its manifestations, treatment, care, everything is different for different persons. And hence we have the Cancer Day theme, United by Unique. Cancer is a public health problem of enormous dimensions. And hence the community needs to be sensitized and it needs to assume great momentum. Sensitizing students in a way is catching them young to equip them with skills to face this large epidemic. Hence the relevance of today's session. Luckily, we could rope in the best available faculty, Dr. Gayathri Gopan, the renowned medical oncologist, for this mission. I, on behalf of the NAMM family, express our heartfelt gratitude to her and once again welcome her. Hope this session reaps the best benefits. And with these few words, I declare that the program is inaugurated with the permission of each one of you. Thank you. Jai Hind, Jai IMA.
Thank you, ma'am. Now I invite Dr. Susie Alex for inviting us, the resource person.
Good evening, all. Today, World Cancer Day, marked on February 5th, to raise awareness of cancer, to encourage prevention, early detection, and treatment. World Cancer Day is observed by the United Nations. As our President, Dr. Indirama said, the theme for 2025-27 is United by Unique. That places people at the center of care and their stories at the heart of conversation. So health is our wealth. So today we would like to hear from Dr. Gayathri Gopan about cancer prevention, care, and treatment. Dr. Gayathri Gopan is a consultant medical oncologist, GG Hospital and Ramakrishna Mission Hospital. I welcome Dr. Gayathri Gopan for the talk. Thank you.
Thank you so much, madam. Thank you, Vima, IMA, as well as Mar Basilios for giving me this opportunity to speak with such a young audience. But I really would like to see your faces. So I asked your Madam Soumya if we could arrange an offline class so that I could interact with you better. So if someone could, is it because of the size of the call that if somebody could on their videos, then it would be better. Pranav, Varna, Diya, Abhaya, somebody. Yes. So as Indira Madam has told, Susi Madam has told, today is the World Cancer Day, and it is a great honor for me to speak to you regarding this topic. So we will be discussing the various causes of cancer, how to prevent cancer, or rather how to detect the cancer early. So you all being youth, you all have to understand the various aspects, not only regarding cancer, because the thing is that, as Madam told, the theme of today's World Cancer Day is United by Unique. Each person's cancer journey is unique. So we have to stand with the patients. As a society, we have to support the patients because they will be going through a lot of physical as well as mental struggle. So we as a society should be with the patient, and society means each one of us, especially the youngsters should be with the patient. And hence we have, so it is a great thing actually to increase awareness of cancer among the public. So I'll just share my screen. Is my slide visible and and can you hear me all?
Yes,
Okay. So today we are going to discuss about the cancer, mainly the cause, care, and what about the cure of cancer, whether cancer is really curable. And we know that many personalities have written books on cancer. There are so many films on cancer. Why is it so? We can have a film on hypertension. We can have films on diabetes. No? We have so many films on cancer, so many books on cancer. Why is it so? I want the young audience to answer. So nobody is listening. Actually, we have so many books on cancer just because, as Indira Madam, Susi Madam has all told, there is actually a lot of stigma in the society regarding cancer, because cancer is a disease that not just affects the body of a person, it affects the mental well-being of the person. That person may actually question his existence, question his spirituality, question his finances are affected, his family relationships are affected. All these, there are actually, this cancer is a multi-dimensional disease. It is not just a physical disease. So yes, of course, diabetes, hypertension are all important diseases, but this is a multi-dimensional interdimensional disease. So that may be the reason why that we have so many literature and other films and many other things associated with cancer. So as Madam mentioned, United by Unique is the theme of World Cancer Day. This shows that all cancers are not the same. Each cancer is unique. The journey that each person undergoes is unique. Diagnosis is different. Everything is different regarding each disease, each person, not only disease, each person. So that is meant by United by Unique. So first of all, let us understand what is cancer. So cancer is actually the normal cells. These normal cells will undergo certain mutations. So how does it undergo mutations? So if we understand how it undergoes mutation, then we will be able to understand how to prevent cancer. So cancer is a disease in which cells multiplicate uncontrollably. They can resist cell death. And not only that, these cells can go from one place to another place. So we have heard about patients having, maybe a breast cancer patient having disease spread to the bone, or sometimes spread to the liver or spread to the lungs. So that does not mean that patient is having a bone cancer and a breast cancer. It is actually the breast cancer cells that have gone from the breast to the bone. So that is actually an advanced cancer. So that is also a property of a cancer cell, that it can move from the place of origin to some other place it likes. Okay, so it is very important to understand what is cancer and the causes of cancer. Okay, so are all cancers the same? No, you should definitely understand that all cancers are not the same. Even if there is if a person comes with a swelling in the breast, not all breast cancers are alike. Even though there is a lump in the breast, we understand that it is a cancer of the breast. Not all cancers are alike. Not even breast cancers are alike. So we can imagine the different cancers in different parts of the body. All cancers are not alike, and we should not label the patients. Okay, you are having cancer, you are doomed to suffer. No, it is not at all like that. Some cancers even do not require any form of treatment. In some cancers, we can just give certain tablets. In some cancers, it may need certain chemotherapy, so milder forms of chemotherapy. There are so many treatment options for cancer. So I want you all to understand all these things. Like, is it true that cancer leads to death? So now I mentioned that it is not like that, because so many treatment options are there. Many people come and ask whether cancer is contagious. So as young people, you should know all these facts, because you may be the caretakers or caregivers or someone else. Okay. So you may be taking care of your elderly grandparents or parents or your other relatives. Okay. So you should understand that cancer is not a contagious disease. You can safely take care of them. Okay. Another important thing is that usually when I go for taking awareness classes, when it is breast cancer, only the females will be there. No, breast cancer can occur in males also, though it is rare. So there are so many misconceptions regarding cancer. Now let us move on to the most important cancer. Do you know the most common cancer? Can anybody tell me? If nobody is answering, then I will stop the presentation. Any student? Anybody who is listening? The answer is there on the presentation.
Breast cancer.
Breast cancer.
Yes, very good, very good, very
Breast
good.
cancer.
Right. Breast cancer is the most common cancer. You should answer. Then only we will be able to have a fruitful discussion. Okay. So as rightly mentioned, Akshaya told, Abhinav told, they told that breast cancer is the most common cancer. And do you know the most common cancer in males? Abhinav, which is the most common cancer in males? Do you know, Abhinav?
Blood.
No, it is not blood cancer. Any other, you know?
Prostate.
No, prostate cancer is not. It is actually rising in India.
Lung cancer.
Yes, Gauri has told that it is lung cancer. Yes, lung cancer is the most common cancer, Gauri, because now in the urban, yeah, Neeraj has also mentioned as lung cancer, right? Because the atmospheric pollution is increasing. And what is the cause for lung cancer? Can anybody say? Any one cause? Any one cause? You all know the
Smoking.
Right. Smoking is a very important cause. Dia has mentioned a very important cause, that is pollution. Very good. Atmospheric pollution is also a very important cause of lung cancer. But actually, there are so many causes for cancer. There are so many causes of cancer. So I will elaborate on that. Okay. And in North India, we have to understand that because of the span chewing, there is a rising incidence of oral cavity cancers. So as youngsters, you should understand that you all are good children, I know. You are all good students. But there are people who use drugs. Okay. They will place the drugs inside the oral cavity, and for some sort of pleasure, they may be using that. But what happens is that there is constant irritation onto the buccal mucosa. So you should tell your friends if you know somebody who uses that, not you, if somebody who uses that, if you place it, that can cause irritation onto the mucosa. Okay. So when you place it on the same area again and again, any area if you put, it can cause abrasions, constant irritations, and it can cause oral cavity cancer. Okay. You all watch movies, right? You all watch movies? Nobody will.
Ma'am.
Yes.
Yes, ma'am.
So when you
Yes.
go to the theater, you can see the advertisement, right?
Yes,
Initially,
ma'am.
oral cavity cancers. You have all seen, right? Abhishek.
Yes, yes.
Yeah.
Yes, ma'am.
Yeah.
Yes, ma'am.
So actually, that is actually true. That is not exaggeration. Okay. Do you enjoy seeing that advertisement? Do you
No,
like
ma'am.
seeing that advertisement? Do you like? No, alle, we don't like seeing such images. So imagine, so that we see it often. So that is the reason why I am telling you all that you should not do something we know that is harmful. Okay, so the drugs, even though that will cause a mild amount of pleasure, it will cause greater harm. It can cause oral cavity cancers. It can cause lung cancer. It can cause liver cancer, all such cancers. But you may think we are all youngsters. We will not get cancer. Only old age people will get cancer. Nobody is immune. I am an oncologist. I see patients daily. Nobody is immune. What you do in the younger period of your life, that the health that you maintain in the younger period of your life will reflect in old age. Okay, so if there is one mutation, there is an insult to the body. You should remember that. When the mutation number increases, the insult to the body increases, and at one point, body's defense mechanism will break down. Okay, and that will lead to the rise in cancer. Understood, everybody? No response.
Yes, ma'am.
Okay.
Yes.
Okay. Now you tell me. Previously people used to say there is no cancer. There was no cancer in the previous days, but now cancer is on the rise. Everywhere there is cancer. That is why we are talking about cancer, right? Today. So why is cancer on the rise? Can you tell me? Why is cancer on the rise? Why? Yeah, Dia has mentioned change in lifestyle. So Dia, what is actually change in lifestyle? What is actually change in lifestyle? Can you tell me? What is actually change in lifestyle? Yeah, food and also change in environment. Can you see my screen?
Yes.
Yes, ma'am. Screen is visible.
Okay, so cancer is on the rise mainly because one thing is the lifestyle changes. So lifestyle changes, what we have to importantly understand is that the food that we are taking. Okay, the food we are taking. Actually, there is an agency, international agency for research on cancer, IARC. IARC has actually classified the food into different categories like possibly carcinogenic, probably carcinogenic, and non-carcinogenic. What is meant by carcinogenic? Carcinogenic means it is something that causes cancer. Okay, so they have grouped red meat as carcinogenic. What is red meat? Red meat means this beef, mutton, and pork are carcinogenic. These are cancer causing. Okay. So Adil is there?
Yes, teacher.
Yes. So Adil, is it okay to have mutton, beef, and all?
No, teacher. Only
It is okay.
no. എപ്പോഴും കഴിച്ചാൽ കുഴപ്പമാണ്.
ആ വെരി ഗുഡ്. അതിൽ പറഞ്ഞതാണ് കറക്റ്റ്. എപ്പോഴും കഴിച്ചാൽ പ്രശ്നമാണ്. എപ്പോഴും എന്നുള്ളതും നമുക്ക് എപ്പോഴാന്നുള്ളത് അറിയണം. ആഴ്ചയിൽ 3 ദിവസം കഴിച്ചാൽ കുഴപ്പമുണ്ടോ അതിൽ?
അറിഞ്ഞൂടാ ടീച്ചർ.
നമ്മൾ മാസത്തിൽ ഒരിക്കലൊക്കെ കഴിക്കാം. ഓക്കെ, ഇഷ്ടമാണെന്ന് പറഞ്ഞു കഴിഞ്ഞാല് പൊറോട്ട ബീഫൊക്കെ എല്ലാ ദിവസവും കഴിക്കാൻ പാടില്ല.
Okay.
So mutton, beef, pork are all carcinogenic. You can have it. You can have it maybe once in 2 weeks and all. You can have it, but not on a daily basis, not on a weekly basis. Okay. So that is one thing you need to remember. And then another thing is that sausages. Then in the Western population they take bacon, like all such processed meat. That is also harmful. Okay. And then another thing is that you should not take too much of this grilled food, smoked food. മുകളിൽ ഉണ്ടാവുന്ന ഈ കരി പോലത്തെ കാര്യങ്ങളെല്ലാം തന്നെ ക്യാൻസർ കോസിംഗ് ആണ്. ഓക്കെ, so you should not be consuming too much of such food also. ഓർക്കോ അതിൽ?
Yes, ma'am.
Okay. So that is one thing that you need to remember about food. Another important thing is regarding smoking. Okay.
Yes, ma'am.
Actually, my screen is not moving. That is.
Hello.
Okay, so cancer is on the rise because of the food habits as well as the lifestyle changes. And also one important thing is that we are all aware of cancer. Previously, people never used to come to OP when they have a breast lump or anything. Now people come for screening. We have to check whether there is cancer. So because of improved detection methods, one thing is that we feel that cancer is on the rise. And another important thing is that people live for a longer age. Previously, 60 years, that was all elderly people, but now it is not like that. 60 is all not at all an age. People live till 70 years, 80 years. So increasing age itself is a risk factor for cancer. So that may be the reason why we feel that cancer is on the rise. Of course, the most important is the lifestyle changes. And these lifestyle changes are related to 90 to 95% of the cancer. Okay. Now, can you tell me like the...
Excuse me, ma'am. മാം സ്ലൈഡ് ഫസ്റ്റ് സ്ലൈഡിൽ ഇരിക്കുവാണ്, ചേഞ്ച് ചെയ്ത് ആവുന്നില്ല. ഫസ്റ്റ് സ്ലൈഡാണ് കിടക്കുന്നത് ഇപ്പോൾ.
ഇപ്പൊ ഒരു നിക്കോട്ടിന്റെ അഡിക്റ്റീവ് എന്ന് പറഞ്ഞ സ്ലൈഡ് കാണുന്നില്ല അല്ലേ?
ഇല്ല മാം, ഫസ്റ്റ് സ്ലൈഡ് ക്യാൻസർ കോസ് കെയർ ആൻഡ് ക്യൂർ, ആ സ്ലൈഡിലായിരിക്കുന്നത് മാമിന്റെ.
Now is it visible? Now can you see the slides?
Yes.
Yes.
Slide ആണ് smoking kills.
Okay, let me just change to slideshow. Now can you see the slide?
ഇല്ല മാം, പ്രസന്റേഷൻ പോയി. Screen sharing off. I put the reward that kills. ആ സ്ലൈഡ് ആണ്.
Okay. So when I on the slideshow mode, it is not visible.
മാം ഇങ്ങനെ മതി, കുഴപ്പമില്ല.
മതിയോ?
മതി മാം, മതി.
Fine. So actually, one important cause for cancer is actually the smoking. Okay. So why do people actually smoke? Can anyone tell me? Abhishek, can you tell me why do people smoke?
I think most of them have stress, so they are using this as a pleasure, source of pleasure.
Okay, so everybody agrees to Abhishek?
Yes.
Yes, okay. So it is a form of stress relief, right, Abhishek?
Yes, ma'am.
Okay, so what Abhishek told is partially true because it contains something called nicotine. Okay, when you smoke, what happens is that nicotine goes to the brain. Okay, and nicotine then releases something called dopamine in the brain. Okay, but that is there for a very short time, Abhishek. And what happens is that once you get the feeling of stress relief, once the person who smokes gets the feeling of stress relief, that person will feel like, okay, I will take one more smoke. Let me see. And actually what happens, this person will develop a habit of smoking and then will become a chain smoker. And what happens, is it possible to stop the smoking habit? Is it?
Yes. But most of the cases, they are facing some difficulty in stopping after using
correct,
continuously.
Exactly. That is correct, Abhishek, because it is actually difficult to stop smoking because by all this will cause an addiction. Your brain will need all these chemicals. You will go to such a state. Okay. So actually we have lung cancer patients who continuously smoke. So people will find it difficult to stop smoking. So we need to ask them to meet a counselor, and there is smoking de-addiction centers are there to help the person out of smoking. It is a long process. Okay. So what you have to understand is that does the cigarette contain only nicotine? Abhaya can answer. Actually, it contains so many different carcinogens. More than 80 carcinogens are there in cigarettes. More person takes in, what happens? mutation develops in the body. I know that you are all good students, you all do not smoke, but you have to spread this message to the society. Okay, it is not something fashionable to smoke. That is the first thing that you need to understand. Okay, it is not fashionable. It is fashionable that we take care of our health. Okay, so that we all should be conscious. We will all think, okay, life is only one. What is the problem in taking one cigarette? Or what is the harm in taking some amount of alcohol? We know that it is harmful. So why do we push our body towards it? That is my simple logic. Okay. So smoking is a very important problem. You should never smoke, and you should tell people who smoke also regarding the harmful events, because you are youngsters and you are the future generation. You are the power of the nation. So you should build a healthy body yourself. Okay. So smoking causes so many different cancers. It is not just lung cancer. It causes so many cancers. Actually, whichever cancer you name, that is caused because of smoking. Blood cancer, breast cancer, stomach cancer, all these different cancers can be caused due to smoking. Okay. Now I need you to listen. Everybody should listen. Okay. There are certain infections that can cause cancer. Do you know some infections that can cause cancer? Any infection that can cause cancer? One infection that can cause cancer is human papilloma virus. Human papilloma virus is actually a sexually transmitted disease. So this human papilloma virus can cause cervical cancer, vaginal cancer, vulval cancer, penile cancer, oral cavity cancers. Like that, many cancers can be caused because of this human papilloma virus. Okay. This human papilloma virus, we can prevent it by taking a vaccine. Have you heard about that vaccine? That is human papilloma virus vaccine. Human papilloma virus vaccine, there are two types of human papilloma virus vaccine. One is actually a nanovalent vaccine and the other is a quadrivalent vaccine. Okay. This nanovalent vaccine offers protection against 9 types of HPV. And quadrivalent offers protection against 4 types of HPV. So you all are less than 26 years, right? You are all 20, 22 and all?
Yes, ma'am.
Yeah. So actually you are the people who can take this HPV vaccine. So this HPV vaccine is actually recommended for males as well as females, but we give preference more to females, and that is taken in the age group between 9 and 26 years. Remember this. Okay. If it is for children less than 14 years, only 2 doses are required. If you take it one now, then the next dose is after 6 months. But after 14 years, then 3 doses are required. One now, then after 2 months, then at 6 months. Okay, so this will offer protection about 70 to 90% protection against this human papilloma virus and thereby cervical cancer. Okay, so cervical cancer was previously on the rise, but now cervical cancer has come down thankfully because of this vaccine. Okay, so this vaccine is FDA approved. It is WHO approved. Indian government has approved, and Indian government has actually started manufactured this quadrivalent vaccine. Okay, so you should remember this, that there is an infection by name human papilloma virus that can cause cervical cancer, and now cervical cancer is preventable. Okay, so that is one thing that you need to remember. Okay. Then another important cause for cancer is alcohol. Is it okay to have some amount of alcohol?
No, ma'am.
No, I did not hear you. Is it okay? No,
No, ma'am.
actually, previously it was told that some amount of alcohol is okay, one drink is okay. So they had actually told that this much ml of wine or this much ml of vodka, that is all fine. Okay. But actually, now what is said is that no amount of alcohol is okay because alcohol can cause so many different types of cancers. It can cause colon cancer, it can cause liver cancer, all such sorts of cancers can be caused because of this alcohol intake. Okay, so people often ask, do all alcoholics get cancer? Do all smokers get cancers? I know of people who don't smoke who get cancer. People often ask like that during classes, people often ask like that. So what I would like to say is that there is a 30 percentage, 30 percentage more chance for smokers to develop cancers than non-smokers. So you don't know where you are going to fall. Is it in the 30 percentage or outside? So why you have to harm your body for this is for smoking and also alcohol. Okay, so alcohol is also completely bad for the body. Smoking is also bad for your body. Alcohol, because one important thing is that if you take alcohol and if you smoke, that is having a synergistic effect. Okay, so that is also one important thing that you need to remember.
Hello, ma'am. Hello. Hello, ma'am. നെറ്റ് കട്ടാകാൻ തോന്നുന്നു. Can we please wait for 5 minutes as she join back?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
മാം ജോയിൻ ചെയ്യുന്നത് വരെ ഇന്ദിര മാഡം, സുസി മാഡം എന്തെങ്കിലും നിങ്ങളുടെ സ്റ്റുഡൻസിനെ അഡ്രസ് ചെയ്യാനുണ്ടോ?
Soumya,
യെസ് മാം.
Dr. Gayathri വരില്ലേ ഇപ്പോ?
നെറ്റ് കട്ടായിരുന്നു, ഞാൻ വിളിക്കാം. അതുവരെ ഈ പിള്ളേർക്ക് എന്തെങ്കിലും ആരെങ്കിലും, ഞാൻ അപ്പോഴേക്കും ഗായത്രി മാമിനെ വിളിക്കാം.
എന്തെങ്കിലും പറയട്ടോ?
യെസ് മാം, യെസ്.
Hello everyone. So now Dr. Gayathri talked to you about smoking, about chewing tobacco, and also about infections and how vaccines prevent from cancer, like HPV vaccines and hepatitis B vaccine. These are the mainly two vaccines, hepatitis B and HPV. Can get vaccinated to prevent cancers. Then, so I'm just continuing until, hi, Dr. Gayathri.
Yes, but I don't know because of this, maybe the size of the call actually it is getting paused in between.
Yeah, okay, please carry on.
Thank you, Susi ma'am. Thank you.
So shall I just continue with with me talking or shall I show the slide also because actually this is getting stuck.
Okay, ma'am, no problem, ma'am. Ma'am, സംസാരിച്ചാൽ മതി. Like everyone is eager to hear to you.
Maybe just as always, maybe because of the increased number of audience, it is getting stuck always. So we were talking about the various infections that causes cancer. We talked about smoking that causes cancer, alcohol that causes cancer, and also the another important thing is regarding the sedentary lifestyle. Okay, nobody has time to walk, nobody has time to do exercises. So bad habits is also very important. You should be active. You should regularly exercise. Physical activity is very important, and weight training is also a very important part in the prevention of cancer. So that is one thing important thing you have to remember, because overweight and obesity is associated with so many different cancers like breast cancer, colon cancer, and all. So does your college has regular sports activities?
Yes, ma'am.
Very good, very good, very good. And another important cause is genetic. So maybe there are persons having members with cancer in the family. So actually, it is not that cancer is always genetic. So we will ask the patient regarding when her mother or father had cancer. If cancer developed at a younger age, maybe at 50 years and 50 years or so, then there is a chance of cancer being genetic. Or if there are multiple family members with cancer, then again there is a possibility of cancer being genetic. Always cancer is not genetic. Another important cause of cancer is stress. So we should actually, as previously, I don't remember, maybe Abhishek or somebody told that we smoke for stress relief. No, actually we have to practice something else for stress relief, like yoga, meditation, exercise. All these are the various things that we can practice to decrease the stress. Everybody will have stress. Everybody will have stress, as students, as doctors or teachers, everybody, homemakers, everybody will be having stress. So the smoking or alcohol or drugs, it is not a solution. It is not at all a permanent solution that will just harm your body and will make you prone to so many different types of diseases. So we have to practice exercise and a healthy lifestyle so that we can prevent or control all these different diseases. So this is the main important part that I wanted to talk to you. And the rest, we will just go through that. And if you have any doubts, you can ask me. You should know regarding the symptoms of cancer. You should understand that persistent symptoms, like there is a lump in the breast, or there is persistent weight loss, if there is white patches inside the oral cavity, if there is change in bowel habits, like alteration of this diarrhea, loose stools, and also constipation, bleeding per stools. If it is persistent, you have to definitely see a doctor, and doctor may order for certain investigations, and these investigations will help understand what the person is having. Okay, do you have any doubts till now regarding the causes of cancer? Even reduced sleep is a risk factor for cancer, because all this will cause an increase in the different chemicals in the body. Chronic inflammatory state is a cause for cancer. Any doubts till now? So see this image. This is actually a white patch on the side of the tongue. This can occur in persons who regularly smoke or use drugs or something that can happen. This is called leukoplakia, and you can even see nodule, ഒരു തടിപ്പ് പോലെ കാണാം ആ കവളിന്റെ ഭാഗത്ത്, അതുപോലെ ഒരു മുറിവ് കാണാം. ഇതെല്ലാം തന്നെ നമുക്ക് ഈ പല ബാഡ് ഹാബിറ്റ്സ് ഉള്ള ആൾക്കാർക്കാണ് ഇത് കൂടുതലായിട്ട് വരുന്നത്. സോ വി ഷുഡ് നോട്ട് സബ്ജക്ട് അവർ ബോഡി ടു സച്ച് ബാഡ് ഹാബിറ്റ്സ് ആൻഡ് ഡെവലപ്പ് ഓൾ സച്ച് ഡിസീസസ്. ഇത്തരത്തിലുള്ള ഡിസീസ് ഒന്നും ജനറ്റിക് അല്ല. യൂഷ്വലി നമുക്ക് എന്തെങ്കിലും സ്മോക്കിംഗ് അല്ലെങ്കിൽ ഡ്രഗ് യൂസ് ഒക്കെ ഉണ്ടെങ്കിലാണ് ഇത്തരത്തിലുള്ള ഡിസീസസ് വരുന്നത്. അനദർ ഇമ്പോർട്ടൻറ്റ് കോസ് ഷാർപ്പ് ടൂത്ത്. Sharp tooth can constantly irritate a certain part of the buccal mucosa on the tongue, and that can further lead to inflammation and further lead to cancer. Okay, then there are symptoms of different types of cancers like lung cancer, persistent cough, hemoptysis means blood in the sputum, weight loss. All these things are different symptoms of lung cancer. Do you know the most important symptom of breast cancer? Do you know? The most important symptom is a painless breast lump. So one thing what I want you to understand is that all lumps in the breast are not cancerous. Okay. In the age group of the people here, like 15 to 35 years, they can have lumps in the breast. Okay, that will be usually benign or non-cancerous lump like cyst or fibroadenoma or something like that, fibrocystic disease. There may be pain at the time of periods or something like that. That is nothing to worry. Okay, but if there is a lump that is increasing in size, or if you recently noticed a lump, that is always better to see a doctor. So doctor will be able to identify whether it is something that needs, and that all lumps are not cancerous, but it is cancerous or not. So these are the main symptoms of cancer. Okay, and one thing you need to tell others, you are all young, so maybe you don't need all these investigations, but you should tell your family members regarding mammogram. Identify cancer early. Okay, it is actually X-ray of the breast. Okay, so this will help in understanding whether there are lumps in the breast, and if there is a swelling in the breast, whether it's cancerous or not. All these things can be understood by a mammogram. So mammogram can be done for asymptomatic or for persons who do not have lump also. They can do this mammogram to detect cancer early. So this is actually done after maybe 40-45 years, and this can be done yearly or once in 2 years, so that we can detect cancer early. Okay, so this is breast cancer is one cancer that can be detected early, and that is with the help of this mammogram. Okay, so this you have to spread the message to the society that mammogram is available in most of the hospitals. It is available, and this can help in the early detection of cancer. One important thing I forgot to tell you is regarding the use of air fryers, microwave. Is it all safe to use all these? Do you have you thought about it? Actually, it is okay to have all these. To air fryer is all fine, but the problem is that you should not put all these starch containing foods like potato and all. If you are preparing French fries and all, high heat at very high heat at short time, that is actually harmful. Okay, raised temperatures and a very short time. If you don't have that much of time, you are raising the temperature and then keeping it for a very short time. That is actually harmful because that will cause the production of a chemical called acrylamide. Okay, this acrylamide, constant use of this acrylamide can lead to cancer. Okay, only if you take large amounts of acrylamide, then only it will lead to cancer. But whatever, it is always better to stick to traditional ways of cooking. You can use air fryers, you can use all such other alternatives, but remember that high temperature, short time is harmful. Okay, you should just remember these 2 points. Otherwise, it is all okay. Data has now come out regarding the harms of air fryers and all. Another important thing what I wanted to convey is, do you all use aloe vera? Aloe vera. Yes. Aloe vera, actually it is very good for skin, it is very good for health, but actually when you see just beneath the green part of aloe vera, just in between the clear gel and the green part, there's a yellow kind of resin. Okay, so you have to wash off the resin and then use the aloe vera because this resin contains a harmful chemical. That is one thing you need to remember. When you use aloe vera, clear gel is fine, that is all okay. But you should remove that yellow harmful resin you have to remove. Okay. Then some people, when they diet, they take this diet coke and something. Do you take that? Have you heard about diet coke?
Yes, ma'am.
Yes, ma'am.
Diet coke actually contains an artificial sweetener by name aspartame. Okay, so whenever you are using these such drinks and all, you should read the label as to what it contains. Okay, so aspartame is actually if you take it on a daily basis, it is not like once in a while. If you take, I'm not talking about that, but if you regularly consume all these things, this can cause problems. This can cause harmful effects in the body, mainly on the liver, because whatever you take, the liver has to bear the load because liver is the thing that detoxifies all these harmful chemicals. Okay, so aspartame is something that can cause liver cancer. Okay, so you should always, whenever you buy something like this chemicals, you should read the label and see if it contains some harmful chemicals or not. See, this class is not enough to elaborate all the different chemicals. I will not be able to elaborate, but you have to see if it is vegetables, fruits, then that is all fine. Okay, but when you take such chemicals or processed food, or when you take this fruit juices, that will all contain preservatives or artificial sweeteners, and that may be linked to development of cancer. That all you need to remember. Okay. Another important thing that I would like to say is regarding breast self-examination. You should understand that breast self-examination can be done for all females over 25 years of age. Every month, 1 week after the end of menses, they can do breast self-examination. Breast self-examination, all the quadrants of breast as well as the nipple and the armpit has to be examined for the presence of any lumps. Okay, so if there is any lump, if you feel that there is any lump, then you can definitely meet a doctor and get your doubts cleared. So once every month, breast self-examination can be done. Okay. Any doubts till now?
മാം മാമോഗ്രാഫിയുടെ കാര്യം പറഞ്ഞല്ലോ. അപ്പം ഇത് നമുക്ക് ഇപ്പം ഏജ് അല്ലെങ്കിൽ എന്തെങ്കിലും ഒരു ഫാക്ടർ ഉണ്ടോ? നമ്മളിപ്പം ചെക്കപ്പിൽ പോകാൻ 6 months once പോകണമെന്ന് മാം പറഞ്ഞിട്ടുണ്ടായിരുന്നു. അപ്പം ഏത് ഏജ് തൊട്ട് പോവാം, അങ്ങനെ എന്തെങ്കിലും ഒരു ഫാക്ടർ?
നമ്മള് വർഷമാണ് മാമോഗ്രാം ചെയ്യേണ്ടത്. ഇയർലി വൺസ് ആണ്. 40-45 ഇയേഴ്സിന് ശേഷം.
ഓക്കെ മാം, ഓക്കെ.
അതാണ് സ്ക്രീനിങ് മാമോഗ്രാമിന്റെ കാര്യം എന്ന് പറയുന്നത്.
ഓക്കെ.
Okay.
Thank you.
Now, cancer treatment, there are so many effective treatment options. Previously, നമുക്കിപ്പോൾ ക്യാൻസർ എന്ന് പറയുമ്പോൾ തന്നെ കീമോതെറാപ്പി എന്നുള്ളൊരു കാര്യം മാത്രമാണ് ഓർമ്മ വരുന്നത്. പക്ഷേ cancer has got so many different treatment options like chemotherapy, surgery, radiotherapy, then hormonal agents, immunotherapy. All these are available here. In Kerala, in India, all these things are available, or all new modalities of treatment are available. So it is not just chemotherapy alone for cancer. So many different treatment options are there. So chemotherapy now it is not associated with that much of side effects because we have so many different agents to control the side effects of chemotherapy. So if you have doubts regarding this, I will be glad to answer because I know this is a young crowd. So you should understand that there are different modalities of treatment for cancer. So chemotherapy is nothing but just like giving drip. നമ്മളിപ്പം പനിയെല്ലാം വന്ന് ഇപ്പോൾ ഡ്രിപ്പ് എടുത്തിട്ടുണ്ടെങ്കിൽ അതുപോലെ തന്നെയാണ് കീമോതെറാപ്പി കൊടുക്കുന്നത്. ഇറ്റ് ഡസ് നോട്ട് റിക്വയർ എനി മെഷീൻസ്. ഇറ്റ് ഇസ് നോട്ട് അസോസിയേറ്റഡ് വിത്ത് എനി റേഡിയേഷൻ. Any person taking chemotherapy can go to other persons. They can be with their grandchildren. They can be near pets. They can be treated just like normal persons. Okay, it is not has nothing to do with social distancing and nothing. They just have to prevent certain infections. That's also. It is just like a normal person. So whatever the other persons are doing, these persons can also do. then radiation, immunotherapy. There are so many cancer treatment modalities are there, and there are effective ways to control the various toxicities of such treatments also. Okay, then genetic testing. Regarding genetic testing, what you have to remember is that in your family, if there is any person with cancer, to understand if there is a increased chance for you to develop cancer, if you feel that there are many relatives having cancer, do I have a chance of developing cancer? You cannot just go to a lab and do a testing for cancer. Okay, you should meet a genetic counselor or an oncologist, understand the family history, and then get a prescription for a particular test, because all tests are not the same. Okay, then another very important, this is one very important thing. One is regarding screening. Yes, Soumya madam has told one important cancer that can be detected early is breast cancer, that is with screening mammogram. Another cancer that can be detected early is cervical cancer, Garbhashya Mukha Arbuda. Cervical cancer can be detected by doing a pap smear. Actually, pap smear can be done from 21 years onwards. Once in 3 years, we can do a pap smear. If it is coupled with this human papilloma virus testing, this can be done once in every 5 years. So this is again one cancer that can be detected early. Another cancer is prostate cancer, that is in elderly males. Lung cancer, it's smokers. To detect lung cancer early, we can use a low dose CT scan. Another is colon cancer. വൻകുടലിലെ ക്യാൻസർ പണ്ടെല്ലാം നമ്മൾ എൽഡർലി ആൾക്കാരിൽ മാത്രമാണ് കണ്ടുകൊണ്ടിരുന്നത്. പക്ഷെ നൗ വി സീ ഇറ്റ് ഇൻ യങ്ങർ പോപ്പുലേഷൻ ഓൾസോ. മേ ബി ദാറ്റ് ഇസ് ഓൾ റിലേറ്റഡ് ടു ദ ചേഞ്ച് ഇൻ ദ ലൈഫ് സ്റ്റൈൽ. ഈ കോളൺ ക്യാൻസറിനെ പ്രിവെന്റ് ചെയ്യാൻ എന്താ കഴിക്കേണ്ടതെന്നറിയോ? കോളൺ എന്ന് പറഞ്ഞാൽ ലാർജ് ഇൻറ്റെസ്റ്റൈൻ. യു ഷുഡ് ടേക്ക് എ ലോട്ട് ഓഫ് ഫൈബർ. മൈദ എല്ലാം കഴിക്കുന്നത് ഹാർംഫുൾ ആണ്. യു ക്യാൻ ടേക്ക് ഇറ്റ് വൺസ് എ വൈൽ, ദാറ്റ് ഇസ് ഓൾ ഫൈൻ. But taking too much is harmful. You should take a lot of fiber so that it flushes out all the toxins. Okay. So colorectal cancer screening is done with the help of mainly colonoscopy. That is after 45 years, every 10 years. Okay. So prevention, we already mentioned. One cancer that is preventable is cervical cancer, and that is with the help of HPV vaccine. Please remember, I know that you are in that age group. You can definitely take human papilloma virus vaccine. That is not associated with any side effects. You can take it, just rest for some time and you can go. Usually it does not cause any fever and allergies. It is a safe vaccine. Okay. It is given intramuscularly. So this is the age group and this is what we discussed right now. So these are the different things that you need to do to prevent cancer. Eat a lot of vegetables. We can eat a lot of fruits. I know that you will be asking regarding pesticides, but now actually the WHO conducts certain assays. So there is a minimum pesticide residue that is allowed, that is okay. If that exceeds, then it is harmful to the body. Okay. Then too much of junk food is harmful. Then sunlight exposure, that is actually for the Western population, that causes skin cancer. Then we have to practice a regular exercise. Okay. These are some famous personalities with cancer who have fought cancer. Okay. There are so many other persons also who come regularly to our OP. They are also real heroes. This slide is being shown not just to remember these two persons, but also to understand that always research is going on in the field of cancer. So even if there is no medicine now, there will be medicine tomorrow. So always there is research, always the field of oncology is changing. So this is my last slide. So we should promise to ourselves to avoid all these bad habits and to be physically fit and to lead and we should try to lead a stress-free life. That we have to identify ways to decrease the stress. Okay, thank you. Thank you so much for the opportunity. And if you have any doubts, I would just be glad to answer. Thank you.
Thank you, Dr. Gayathri, Gopan. The information and your take-home message to avoid smoking, healthy lifestyle, and the vaccination, avoid smoking. They are all very helpful also and informative for the students. And they can ask questions.
ആർക്കെങ്കിലും ഡൗട്ട്സ് എന്തെങ്കിലും ഉണ്ടെങ്കിൽ ഇപ്പം ചോദിക്കാം. ബാക്കി 2 മീറ്റിലുള്ളവർക്ക് ചാറ്റ് ബോക്സ് ഇടുവാണെങ്കിൽ അത് ഇവിടെ വായിക്കാം. IETയുടെ അക്കൗണ്ടിൽ ഇവിടെ വായിക്കുന്നതായിരിക്കും. മാം 3 മീറ്റിംഗ് ലിങ്കിലാണ് കണക്ട് ചെയ്തിരിക്കുന്നത്. നമുക്ക് പാർട്ടിസിപ്പൻസ് അബൌട്ട് 225 ഉണ്ടായിരുന്നു.
ഓക്കെ.
അതർ ചാറ്റിന് ഒരു മെസ്സേജ് വന്നിട്ടുണ്ട്.
അല്ല, അങ്ങനെ സ്റ്റാർസ് കണ്ടന്റ് അവോയ്ഡ് ചെയ്യണം എന്നല്ല ഞാൻ പറഞ്ഞത്. എയർ ഫ്രയേഴ്സിൽ വെക്കുമ്പോൾ സ്റ്റാർസ് കണ്ടെയ്നിങ് ഫുഡ് ഇഫ് യു keep at a high temperature for a short time, this can lead to formation of a chemical called acrylamide. If you take this acrylamide for a long duration, a large amount of acrylamide, that can lead to cancers. Otherwise, there is no problem.
Good evening, ma'am. Thank you for the session. It was really good. അപ്പോൾ എനിക്കൊരു ഡൗട്ട് ഉണ്ടായിരുന്നു. ഈ സൺസ്ക്രീൻ ഉപയോഗിക്കണം എന്ന് ചിലർ പറയുന്ന കേട്ടിട്ടുണ്ട്, മസ്റ്റ് ആയിട്ട്. അത് അത്രയ്ക്കും നെസസറി ആണോ?
നമ്മൾ ഒരുപാട് സൺ എക്സ്പോഷർ വരുന്നു. ഇപ്പൊ ഫോർ എക്സാമ്പിൾ ഇപ്പൊ നമ്മുടെ നിങ്ങളിപ്പം ഗ്രൗണ്ടിൽ കളിക്കാൻ ഗ്രൗണ്ടിൽ ഇപ്പൊ പോകുന്ന എന്തെങ്കിലും ഇവന്റ് ഉണ്ടെങ്കിൽ, ലൈക്ക് സ്പോർട്സ് ഡേ ഓർ സംതിങ് അങ്ങനെ ഉണ്ടെന്നുണ്ടെങ്കിൽ then it is definitely better to use a sunscreen. Every day you are not, if you are sitting in the classes for majority of time, then it is okay not to use. But if there is you are definite that today there will be a lot of sun exposure, then you can use.
ഒരു മിനിറ്റ്, ഒരു സെക്കൻഡ് ഞാനൊന്ന് പറഞ്ഞോട്ടെ. ഡോക്ടർ ഗായത്രി, ഞങ്ങൾക്ക് നിയമം ബ്രാഞ്ച് എന്ന് പറയുന്ന ഒരു ചെറിയ ബ്രാഞ്ചാണ്. അപ്പൊ അവിടെ നടത്തുന്ന പ്രോഗ്രാം ഒക്കെ ഭയങ്കര പ്രോഗ്രാമാണ്. അപ്പൊ ഞാന് എംഎൽനോട് ചോദിച്ചപ്പോൾ പറഞ്ഞു ഏറ്റവും ഐഡിയൽ പേഴ്സൺ ഡോക്ടർ ഗായത്രി ഗോപനാണ്. ഇപ്പൊ തന്നെ വിളിച്ച് ബുക്ക് ചെയ്തോ, അല്ലെങ്കിൽ ക്യാൻസർ ഡേയുടെ അന്ന് കിട്ടൂല എന്നൊക്കെ പറഞ്ഞാണ് ഞാൻ അന്ന് ശല്യം ചെയ്തത്. പിന്നെ ഇവിടുത്തെ സ്റ്റുഡൻസ് എന്ന് പറഞ്ഞാൽ അവർ ഭയങ്കര ഇൻട്രസ്റ്റഡ് ആണ് കേട്ടോ. മാർ ബസീലിയോസിൽ ഞങ്ങളുടെ ഡോക്ടർ സൗമ്യ എന്ന് പറയുന്നത് കഴിഞ്ഞ വർഷത്തെ നോൺ സ്പോർട്സ് ഡോക്ടറുടെ PhD ഡോക്ടറാണ്, എഞ്ചിനീയർ ആണ്, അവിടുത്തെ പ്രൊഫസറാണ് പുള്ളിക്കാരി. അല്ലാതുള്ള ഞങ്ങളുടെ IMA നിയമത്തിന്റെ സ്റ്റേറ്റിന്റെ വിമ അവാർഡ് കിട്ടിയ ആളാണ്. കോർഡിനേറ്റർ എന്നുള്ള നിലയിൽ ഞങ്ങളുടെ പ്രോഗ്രാം എല്ലാം ഒരുപാട് കോർഡിനേറ്റ് ചെയ്യുന്നതൊക്കെ ഡോക്ടർ സൗമ്യയാണ്. സൗമ്യക്ക് ഭയങ്കര ഒരു എന്താ പറയാ, ഒരു നല്ല വാക്ക്. ഇങ്ങനെ ഒരു പ്രോഗ്രാം ക്യാൻസർ ഡേയുടെ അന്ന് തന്നെ അറേഞ്ച് ചെയ്തതിന്. ഞങ്ങൾക്ക് മലയിലിരുന്ന ഒരു പ്രോഗ്രാം ഉണ്ടായിരുന്നു. ഞാനും ഡോക്ടർ മോഹൻനായരും അതിൽ പങ്കെടുത്തു. ക്യാൻസർ ബ്രസ്റ്റ്, ക്യാൻസർ സർവീസ്, ജനറൽ ക്യാൻസർ അവയർനെസ് ക്ലാസ്, പിന്നെ ഒരു വാത്സല്യം ക്യാമ്പ് എന്ന് പറഞ്ഞ ഞങ്ങളുടെ നിയമം ബ്രാഞ്ചിലൊരു പ്രോജക്റ്റ് ഉണ്ട്. അത് അവയർനെസ് ആൻഡ് ഡിറ്റക്ഷൻ ക്യാമ്പാണ്. അതിൽ ഞാൻ ഇന്ന് വന്നവരെ എക്സാമിൻ ചെയ്തു. കുറച്ച് സസ്പീഷ്യസ് ആയിട്ടുള്ളവർക്ക് മാമോഗ്രാം അൾട്രാസൗണ്ട് ഒക്കെ എഴുതി കൊടുത്തിട്ടുണ്ട്. അങ്ങനെ ഇന്നത്തെ ഞങ്ങളുടെ 4th മീൻസ് February 4th ക്യാൻസർ അവയർനെസ് ഡേ നല്ലൊരു തുടക്കമായിരുന്നു. നല്ലായിരുന്നു. ഗായത്രിയുടെ ക്ലാസ് ഭയങ്കര നന്നായിരുന്നു, വളരെ യൂസ്ഫുൾ ആയിരുന്നു. താങ്ക് യു വെരി മച്ച്. താങ്ക് യു.
കുറെ സ്ലൈഡ്സ് സ്കിപ്പ് ചെയ്തത് നമ്മുടെ കുട്ടികൾക്ക് അത് യൂസ്ഫുൾ ആയിരിക്കുമോ എന്നുള്ളൊരു ഡൗട്ടിലാണ് മെയിൻലി കോസസിൽ ഫോക്കസ് ചെയ്ത് ക്ലാസ് എടുത്തത്.
മാം, one more question. Is there any general test for us to check if we have any sort of cancer? ഇത് വേറൊരു ചാറ്റിന് വന്നതാ, 3ാമത്തെ ചാറ്റ്.
അങ്ങനെ ഒരു ജനറൽ ടെസ്റ്റ് ഇല്ല. ഞാൻ പറഞ്ഞ പോലെ ജനറ്റിക് ടെസ്റ്റ് ഉണ്ട്. അത് നമുക്ക് അങ്ങനെ എല്ലാവർക്കും വെറുതെ ലാബിൽ പോയി ചെയ്യാൻ പറ്റുന്ന ടെസ്റ്റ് അല്ല. ആദ്യം ഒരു ജനറ്റിക് കൗൺസിലറിനെ അല്ലാന്നുണ്ടെങ്കിൽ ഒരു ഓങ്കോളജിസ്റ്റിനെ കണ്ട് സിഗ്നിഫിക്കന്റ് ആണെങ്കിൽ ഏത് ടെസ്റ്റ് ഓർഡർ ചെയ്യണമെന്ന് മനസ്സിലാക്കിയിട്ട് വേണം നമുക്ക് ടെസ്റ്റ് ചെയ്യാൻ. ജനറൽ ആയിട്ട് ടെസ്റ്റ് ഇല്ല. ബട്ട് ഓഫ് കോഴ്സ്, as I mentioned, screening tests are there like mammogram, pap smear, all these tests are there.
Dr. Gayathri, I have one about this screening for lung cancer.
madam.
അപ്പോൾ ഈ ലോ ഡോസ് CT പറഞ്ഞ ഒന്നുകൂടെ എക്സ്പ്ലെയിൻ ചെയ്യാമോ?
അത് ആക്ച്വലി സ്മോക്കേഴ്സിനാണ് മാഡം. അതായത് 15 ബാക്ക് ഇയേഴ്സ് സ്മോക്ക് ചെയ്തിട്ടുള്ള ആൾക്കാർ, അല്ലെങ്കിൽ കറന്റ് സ്മോക്കിംഗ് കണ്ടിന്യൂ ചെയ്യുന്ന ആൾക്കാർക്ക് ആഫ്റ്റർ 50 years ഇയർലി ലോ ഡോസ് CT സ്കാൻ ക്യാൻ ബി ഡൺ സോ ആസ്, ബിക്കോസ് ലങ് ക്യാൻസർ ഡിറ്റക്ട് ചെയ്യുമ്പോൾ തന്നെ മാഡം അത് നമ്മളെ അഡ്വാൻസ് സ്റ്റേജസിലാണ് ഡിറ്റക്ട് ചെയ്യുന്നത്. അതുകൊണ്ടാണ് ഇങ്ങനെ ഒരു പ്രോട്ടോകോൾ ഉള്ളത്.
എന്തെങ്കിലും കേസിൽ എനിക്ക് വിഷമം വരും.
Okay. So no more questions?
Any more questions?
Hi ma'am. ഞാൻ അഭിഷേകാണ് മാം. ഏർലി സ്റ്റേജസിൽ നമുക്ക് ക്യാൻസേഴ്സ് ഭയങ്കര റെയർ ആയിട്ടുള്ളൊരു കേസായിരുന്നു. ഈ കോവിഡ് ഒക്കെ വരണതിന് മുമ്പും ഇത് ഭയങ്കര റെയർ ആയിരുന്നു. പക്ഷെ ഇപ്പം നമ്മളൊരു സറൗണ്ടിങ്ങിൽ നമ്മൾ നോക്കിക്കഴിഞ്ഞാൽ ഒരു കുടുംബത്തിൽ ഒരാൾക്കെങ്കിലും ക്യാൻസർ അഫക്റ്റ് ചെയ്ത് അവര് റിക്കവർ ചെയ്തിട്ടോ അല്ലെങ്കിൽ ഇപ്പം അതിൽ ഗോ ത്രൂ ചെയ്യണവരോ ഒക്കെ ഒരുപാടുള്ള ഒരു സെനാരിയോ ആണ് ഇപ്പം നടക്കുന്നത്. അപ്പം അതിന് ഇപ്പം നമ്മളിപ്പോൾ ഒരു സോർട്ട് ഓഫ് ഡ്രഗ്സോ അങ്ങനെ ഒന്നും യൂസ് ചെയ്യാത്തവർക്ക് പോലും ഈ കറന്റ് സെനാരിയോയിൽ നമുക്ക് ഈ ഇത് കാണുന്നുണ്ട്, ഈ ക്യാൻസർ എഫക്ട് ചെയ്യുന്നുണ്ട്. അപ്പം അതിനെന്തായിരിക്കും മാം ഒരു ഇത് വരുന്നത്, അതിനെന്തായിരിക്കും ഒരു കോസ്?
അത് ഇപ്പം അഭിഷേക് ചോദിച്ചത് ഒരുപാട് പേര് ചോദിക്കുന്നത് റെലവെന്റ് ആയിട്ടുള്ള ഒരു ക്വസ്റ്റ്യൻ ആണ്. നമുക്ക് കോവിഡിനെ നമുക്ക് അതിൽ ലിങ്ക് ചെയ്യാൻ പറ്റൂല അഭിഷേക്, ബിക്കോസ് ഇതിനകത്ത് ഇപ്പൊ ഒരുപാട് ഫാക്ടേഴ്സ്. ഇപ്പം സെഡന്ററി ലൈഫ് സ്റ്റൈൽ, കോവിഡിന്റെ സമയത്ത് സെഡന്ററി ലൈഫ് സ്റ്റൈൽ കൂടി. ഓക്കെ, അതുപോലെ ഇപ്പം നമ്മളിപ്പം അറ്റ്മോസ്ഫിയറിക് പൊല്യൂഷൻ എടുക്കാനാണെന്നുണ്ടെങ്കിൽ അറ്റ്മോസ്ഫിയറിക് പൊല്യൂഷൻ കൂടി വരുന്നു ഇല്ലേ? നമുക്കിപ്പം എറണാകുളത്ത് ഇപ്പം ബ്രഹ്മപുരം ഇൻസിഡന്റ് ഉണ്ടായി. ബ്രഹ്മപുരം ഇൻസിഡന്റിൽ ഒരുപാട് പ്ലാസ്റ്റിക് കത്തിക്കരിഞ്ഞതാണ്. അങ്ങനെ there are so many different factors that causes cancer. അപ്പൊ കോവിഡ് എന്ന് നമുക്ക് മാത്രം പറയാൻ പറ്റത്തില്ല, ബിക്കോസ് ഒരു ഇൻഫ്ലമേറ്ററി സ്റ്റേറ്റ്, ഇപ്പൊ ഫോർ എക്സാമ്പിൾ ഇപ്പൊ ഡയബറ്റീസോ എന്താണെങ്കിലും ഒരു ക്രോണിക് ഇൻഫ്ലമേഷൻ എന്ന് പറയുന്നതാണ് ക്യാൻസറിന്റെ ഒരു റിസ്ക് ഫാക്ടർ എന്ന് പറയുന്നത്. സോ കോവിഡ് നമുക്ക് അങ്ങനെ റിലേറ്റ് ചെയ്തിട്ട് നമുക്ക് പറയാനായിട്ട് സാധിക്കില്ല. ബട്ട് ദർ ആർ സോ മെനി ഡിഫറെന്റ് ഫാക്ടേഴ്സ്
കോവിഡിന് മുമ്പ് നമുക്കിപ്പം
അങ്ങനെ റെയർ എന്ന് പറയാനില്ല, മുൻപും ക്യാൻസേഴ്സ് വേർ ദെയർ.
അല്ല മാം, ഈ സ്നീസ് കഫ് എന്നൊക്കെ ഉള്ളത് നമുക്ക് ആ ഒരു ടൈമിൽ കൂടുതലായിരുന്നു. പക്ഷെ മാസ്ക് ഒക്കെ യൂസ് ചെയ്തതിനു ശേഷം അതിന്റെ എമൗണ്ട് കുറഞ്ഞിട്ടുണ്ട്. അതുപോലെ ഈ ക്യാൻസറിന്റെ ആ ഒരു കൗണ്ട് കുറയ്ക്കാൻ വേണ്ടി നമുക്ക് എന്തെങ്കിലും പ്രിക്കോഷൻ എന്നുള്ള രീതിയിൽ വല്ലതും എടുക്കാൻ കഴിയുമോ എന്നുള്ളതായിരുന്നു.
ക്യാൻസറിന്റെ പ്രിക്കോഷൻ ആയിട്ട് നമ്മൾ എടുക്കണം എന്നുണ്ടെങ്കിൽ നമുക്ക് ചെയ്യാൻ പറ്റുന്ന, നമുക്കായിട്ട് ചെയ്യാൻ പറ്റുന്ന കാര്യങ്ങൾ എന്ന് പറഞ്ഞു കഴിഞ്ഞാല്, ഇപ്പം ബോഡി തരത്തിൽ പറഞ്ഞു കഴിഞ്ഞാൽ ഇപ്പൊ നമ്മൾ സ്മോക്കിംഗ്, ആൽക്കഹോൾ, ഫുഡ്, ഫിറ്റ്നസ്, ഈ കാര്യങ്ങൾ നമുക്ക് നോക്കാൻ പറ്റും. നമുക്ക് അറ്റ്മോസ്ഫിയർ ആയിട്ട് ചെയ്യാൻ പറ്റുന്ന കാര്യം എന്ന് പറഞ്ഞാൽ നമുക്ക് സ്വന്തമായിട്ട് പ്ലാസ്റ്റിക്കിന്റെ ഉപയോഗം കുറയ്ക്കാം. നമുക്ക് സ്വന്തമായിട്ട് അറ്റ്മോസ്ഫിയറിക് പൊല്യൂഷന്റെ അളവ് നമുക്ക് കുറയ്ക്കാം. നമുക്ക് ഇപ്പം മറ്റുള്ളവരെ എഡ്യൂക്കേറ്റ് ചെയ്യാം. ഈ കാര്യങ്ങളൊക്കെയാണ് നമുക്ക് ചെയ്യാൻ പറ്റുന്ന കാര്യങ്ങൾ. അല്ലാതെ നമുക്കൊരു മരുന്നോ അല്ലെങ്കിൽ അങ്ങനെ ഒരു ടെസ്റ്റോ, ഈ ജനറൽ ആയിട്ടുള്ള ടെസ്റ്റോ അങ്ങനത്തെ കാര്യങ്ങൾ നമുക്കിപ്പം നിലവിലില്ല. Somebody has asked to explain about the vaccine again. Vaccine, human papilloma virus vaccine. There is actually 2 types. One is quadrivalent and one is nanovalent. This can be taken between 9 and 26 years of age. So before 14 years, actually only 2 doses are required, 0 and 6. This is taken intramuscularly. And after 14 years, 3 doses are required, 0, 2 and 6. അതായത് ഇപ്പൊ എടുക്കുവാണെങ്കിൽ അടുത്ത 2 മാസം കഴിഞ്ഞ് അത് അടുത്തത് 4 മാസം കഴിഞ്ഞ് ആ രീതിയിലാണ് 3 ഡോസ് എടുക്കുന്നത്. ഇറ്റ് ഇസ് എ സേഫ് വാക്സിൻ ആൻഡ് ഓഫേഴ്സ് അബൌട്ട് 70 to 90% പ്രൊട്ടക്ഷൻ അഗൈൻസ്റ്റ് ഹ്യൂമൻ പാപ്പിലോമ വൈറസ് ട്രാൻസ്മിറ്റഡ് cancers.
If no more questions, I will